There are some criteria you should take into consideration before starting an antibiotic medication for any patient that is having pneumonia. All right. So even if you confirm that a patient has pneumonia, you have to be careful about going about doing all those antibiotic treatments and all that. All right. So there are some criteria that you must see before you now start anything antibiotics. Right. So all right. So these are the criteria. What are the criteria? Okay. Criteria to switch to oral antibiotics. Oral antibiotics. Criteria for what? Oral antibiotics medication. It's oral antibiotics. Now, you have to switch to oral antibiotics if patient meets any of the following criteria. So if the patient is having an improved cough and dyspnea, like let me say about improved cough means they have been coughing crazy, but the cough is now going down. All right. Dyspnea is difficulty in breathing, right? So their difficulty in breathing is now going down. All right. So you can now switch to oral antibiotics because they are now getting better. All right. Then if they are afebrile on 2 occasions, that's their temperature is like within the normal temperatures. So if they are afebrile on 2 occasions, 8 hours apart, you can now introduce oral antibiotics, right? If otherwise improving way, why this criteria? I don't really understand that. Then if they have a decreased white blood cell count, then you have to switch from anything intravenous to what? Oral. Then if they have a functional GIT tract with an adequate per hours intake, so if the GIT is now functioning very well, motility, they are easing themselves, they are defecating and all those stuff, then you know that you can now introduce anything oral and it will still be okay. Alright. So these are the criteria for what? Switching to oral antibiotic medication for pneumonia patients.